Hello, I'm Dr. Mark Dailey, and we're starting out on one of our first of several video series on thyroid conditions. I'm going to cover, as mentioned earlier, the three most common thyroid conditions and their symptoms, why your medication isn't working, 6 reasons why your thyroid tests may be normal, but you still feel horrible, the autoimmune connection to certain thyroid conditions, the tests that you must do with thyroid conditions, and the natural approach to wellness. It may seem like we're starting out a little bit slow, but I need to lay a foundation that we can build on, leading to what we look for from a clinical perspective and how we deal with each issue from a nutritional and metabolic standpoint. The most important thing to remember about the thyroid gland is that it's highly sensitive to the slightest alterations in the body. When the thyroid malfunctions, as it eventually does for an estimated 27 million Americans, the thyroid happens to be one of the most complex hormone-producing or endocrine glands in the body, which is probably why so many people don't fully understand how it functions. This is truly the frustration of so many women. They suffer from all the symptoms of hypothyroidism, yet their lab tests are normal. The other possibility is that they've been put on medication which either never worked or worked for a while, and then the symptoms slowly came back. We call that kind of a honeymoon period with these hormones. Because each system of your body is interdependent on the other, and each gland is interdependent on the other, it is possible to have a healthy thyroid gland yet suffer from all the symptoms of hypothyroidism. Do you remember as a kid lining up dominoes so carefully so you could push them down and see the chain reaction of each one of them falling? Well, your entire body is set up like that in the respect that if one area malfunctions, it'll affect the others. With the body, it's like the dominoes are almost lined up in a circle, and no matter which one you push down, it'll eventually affect them all. So a gastrointestinal condition will affect the thyroid gland. A liver condition will affect the thyroid gland. An adrenal issue will affect the thyroid gland. And of course, the thyroid will affect each of these systems. Now, there are 3 main thyroid conditions. Hyperthyroidism, also known as Graves' disease. Hypothyroidism, which is an underactive thyroid, which most of you would be diagnosed with. And then there's Hashimoto's thyroiditis. Graves' disease is the most common form of hyperthyroidism, occurring when your immune system mistakenly attacks your thyroid gland and causes it to overproduce the hormone thyroxine, or T4. The higher T4 level can greatly increase your body's metabolic rate, which may affect you in numerous ways, from your moods to your physical appearance. Graves' disease is rarely life-threatening, although it may develop at any age and in either men or women. Graves' disease is more common in women and usually begins after age 20. Symptoms of Graves' disease might be anxiety, irritability, difficulty sleeping, fatigue, a rapid or irregular heartbeat, a fine tremor of your hands or fingers, an increase in perspiration, sensitivity to heat, weight loss despite normal food intake, brittle hair, enlargement of your thyroid, or what we call a goiter, change in menstrual cycles, frequent bowel movements. So these are some of the things. This is the condition I see the least. So we'll be concentrating on hypothyroidism and Hashimoto's thyroiditis for the bulk of the time. Thank you.